Welcome to Pennsylvania in Focus. I'm Kristen Smith. Joining me today is the Center Square's Pennsylvania reporter, Christina Lingell. Christina, let's talk about this upcoming hospital closure. I mean, it's not surprising given what we're going through in Pennsylvania, but talk to us a little bit more about it.
Yeah, so Chester-Crozer Hospital in Chester is possibly on the verge of closing. They were able to stave off an immediate closure when they got a donation from a local nonprofit, but they really need a buyer soon to be able to keep their doors open. They were owned by a private equity firm, and that private equity firm announced bankruptcy last month. So that's a pretty big blow, especially to the area, because there's another hospital, Taylor Hospital, right in the area that is also owned by that firm.
I think too, in Pennsylvania, there would probably be two groups of people. There's the groups of people who could live within distance of UPMC, Philadelphia, CHOP, something like that, or Penn State. And then there's the other half that live near nothing, essentially. And this is kind of an interesting one because it is still in a relatively populated area. But when you pull back and look at it statewide, I mean, how big of an issue is this private equity investment in healthcare?
It's a huge issue statewide. It's actually a huge issue nationally as well. Chester specifically, I mean, it's a very populated area and it's not far from Philadelphia. It is like right in UPenn's backyard, but it is the only hospital within 15 minutes for if there's a trauma, that 15 minutes is essential. So, even in urban areas, it's becoming a huge problem. But private equity owns 13 hospitals in Pennsylvania. I think 9 of those are just one single firm. So if you were to see the same thing happen that happened with Prospect, you would see 9 of the state's hospitals go under. That's especially concerning if you think about Chester, so close to Philadelphia, if that's going to cost lives because people can't get that 15 minutes, those hospitals out in more rural regions where there's only one for an hour or so, like that's going to be a huge problem.
Right. In Chester in particular, we wrote about recently that they are dealing with a lot of healthcare issues just based on environmental justice concerns. So for them to lose a hospital on top of the other systemic issues in their community, it's not new, but it's a different layer of this healthcare crisis that we have in Pennsylvania. It's not just a worker shortage and it's not just hospital monopolies, but it's just people physically being close enough to care and being able to get there. And so is there any solution? Is there any kind of legislative bill for this? What are they thinking?
Yeah. So currently there is a bill being proposed in the Senate to make it so that private equity firms can't own or manage hospitals. You have, in the discussion, there's a lot of people who are aware that it's unlikely, especially at the state level, to legislate private healthcare out of the system. It's so baked into the way that we operate. But there are a lot of people proposing more of a happy medium where at least keeping equity and keeping those invested in the financial side of things out of the decision room when it comes to patient care. Trying to really separate them, even if there is going to be this financial investment into the healthcare system, separating it from treatment and deciding what should be available at different hospitals. Because if you see, a private equity firm saying, well, we have these assets, maybe we could sell off this piece of land or this building that's part of this hospital system, or we could cut staff here. That's going to affect how patients are treated. And it's going to affect staff too. There's a lot of people who aren't interested in working in the healthcare field in those conditions, people who are really jaded by it. I actually spoke to a nurse yesterday who had been at Memorial Hospital in York, where there was a shooting recently, And just talking about the conditions, you know, of course that shooting was anomalous in the severity, but just the general environment for staff in hospitals right now isn't good. And Pennsylvania has one of the largest shortages of nurses and stuff like that. So we really can't afford to lose hospitals or lose people who are willing to work in them because of these private equity firms.
All right, Christina, thanks for joining us today. To keep up with this story, follow us at thecentersquare.com.